It's time for New Wellness TV with Dr. Lee. Join your host, the accomplished Dr. Cherilyn Lee, as she welcomes the leading experts in health and well-being as they explore the advancements in natural health, physical fitness, nutrition, integrative medicine, and self-discovery.
Good day, everyone, and I want to say that I am honored and blessed to be here another day. And this topic today is very passionate to my heart. Number one, because I've lost several family members to cardiovascular disease and strokes. So I decided that I would do a show just on cardiovascular. Not so much just do a show. We have a device, a measuring tool, an assessment that's FDA approved, designed by a cardiologist, a team of cardiologists, that we can do a 3-minute test so we don't have to guess what's going on with our overgeneral system, which is important. So it's the cardiovascular, the autonomic nervous system, stress level. It is so much more. So we're going to go into this because a lot of people are not aware that a lot of things happening to them is stemming from a deficiency or an imbalance in the autonomic nervous system. So I'm going to go through step by step with you today. And then you can call me, or in December, I'm going to be at the Marriott. I'll have more information for you on the next show. And I will be providing this wonderful test, this 3-minute test, and not guess, that can save your life. So we want to first start off by talking about cardiovascular disease. Accounts for, as we know, over 80,000 deaths. 80,000 deaths per year in the United States. That's a lot of people. And the ones that don't die end up with debilitating diseases, debilitating conditions that we don't want to deal with. So we want to know. We want to know, we don't want to guess. Like I said, this is very passionate for me because after losing my father and also my stepfather from cardiovascular diseases, this is very passionate to me. And myself for suffering from years and years ago from malignant hypertension as something that I have, through epigenetics, been able to turn around a lot and been in 2 comas. So I am very passionate to know what is out here where we can find out some quick answers. This test is not a standalone test. It is not a standalone. But in 3 minutes, you can find out a wealth of information, a plethora of information to help save your life and your family member's life. So I want to say that it's sad that three out of every 3 deaths, more and more people are suffering from this. And everyone know that there's someone in your family that has been touched. So I hope that you will follow along with me on this wonderful show today, because you're going to obtain some valuable information. But most important, you must have this test, because everything that I'm showing you in this presentation today or on this show today, we actually can test, and you can have this information in front of you in just 3 minutes. So I want to say that the importance, and how do we start? First, we want to start with a whole schedule. We want to start with step 1, and step 1 would be your 3-minute test. That's step 1. Step 1 is your 3-minute test. Step 2 is get your results. In 3 minutes, you'll have your results. And step 3 is we must take action. So it isn't just you getting results. You must take action on these results so that we can live a healthier life. We know, too, that stroke and other cardiovascular disease in women, and more women are dying faster from stroke than they are from breast cancer. So, again, it behooves you to really have this test done and see where you are so we can test and not guess. What is cardiovascular system? The cardiovascular system makes up of blood circulating through the heart and going through the entire body. There's a lot more technology to it that I'm not going to get in today on this show, But we want to know that you want to know that the cardiovascular is your heart, the vessels of your heart, your your arteries, your veins, and everything of your heart. So you want to know what it comprises of. And like I said, this test is very, very valuable. So the cardiovascular system covers a lot. It covers from the top of your head to the sole of your feet. Now, this machine is a very simple looking machine. Very, very simple. What you see there is what the machine is, and it's a tiny little probe that's placed on your hand, and then we go through and we can find out. And it picks up the pulse waves that's going through the body and actually analyzes. So a lot of you have been in ICU and in the hospital, and you've had a probe put on your finger to measure your oxygen. Well, this here can measure your heart rate. It can measure so many things, as I'm going to be going through today. So again, thank you so much for bearing with me, and let's keep moving right ahead. So the next slide, you're going to see that this is what you're going to actually see on the screen. When you have your test, you'll see this. I know right now that doesn't mean anything to you. And the next page is also some very, very valuable information. And the one thing I want to say that as we go through this, you're going to be able to get the results and take action. We must take action. So as we look at our next screen, it shows you your heart rate. It's going to get into the heart rate. You know, our heart rate should be in a certain range. It's going to let you know whether or not we call them, in the test it says artifacts, but actually the artifacts are arrhythmias. And a lot of times within 3 minutes, you shouldn't have over 6. So we'll be able to find that out as well. I had a lady that came to me that was scheduled for a pacemaker because she had greater than actually 70 artifacts or arrhythmias in 3 minutes. She had 76. And she was saying, I don't think I want to do this. And after I did her test in the clinic, she was able to find out that I have to do this. And I encouraged her to leave my office and go see her doctor right away. Because with that many abnormal heartbeats or cardiac arrhythmias, which is an abnormal heartbeat, you want to make sure that, and for some reason, I don't know why, I'm so used to having a guest in the show, so just bear with me. I'm here by myself, so I'm used to always having a guest and talking to people. I know I'm talking to my wonderful listening audience, and thank you so much for tuning in today, because it's so important to me that you have this wonderful information. But again, you want to know that what you to expect when you have this test here. And the one good thing about it too, it will give me the ratio of plaque in your arteries. It will allow me to find out your percentage. Now there's level 1, 2, all the way across as you see there. And it's going to allow me to find out the level of plaque that you have in your body. The level of plaque. Can you imagine? And a lot of times, a lot of people will have the plaque and we don't know exactly where it is in the body. But if you come up a level 2 or type 2 at 68%, and 68% is pretty high at a type 2. Then it's going down to a type 3, as you see on the chart, and maybe that's even at a higher percentage than maybe in the 60s. So we know that your plaque level is getting worse. You want to know, because there's things we can do to turn this around. Again, this is a 3-minute test with all this valuable information. So the plaque level can be picked up in 3 minutes, but this is giving me a generalized. So when I see this, one thing I want to know, if you have a lot of plaque in the artery, where is this in the body? Now, we've done coronary artery testing with the ultrasound, as I do stroke screening with testing the coronary artery, along with this machine too, and have also picked up the plaque, but we didn't have the percentage. But now we have the percentage throughout the entire body. So you want to know, is this plaque in your legs? Is in the arteries or veins in the leg? or is it in coming from the heart? Where is this? Or do you have coronary artery disease? Do you have plaque around the artery around your heart? So these things are imperative that you need to know because those are some leading causes of heart attack, or plaque can break off and pulmonary embolisms, and all kind of things can happen. So knowing the percentage of where the plaque is, and then this is retestable. You can go on a program and see, am I healing? Is this getting better or is it getting worse? So it's so important that you know this. A 3-minute test. I keep emphasizing in 3 minutes. Now, again, if I find this, I want to maybe have you set up or see your cardiologist. I work with some wonderful cardiologists, and one is a functional medicine cardiologist. And I do a lot of referral because I am not a cardiologist. I want to just make sure we work on early screening and prevention. Because you know better, guess what? You do better. Okay? Along with our diet and nutrition. The good thing about this test, too, it also allows me to find out, and as you're looking at the other slide there, it shows you the plaque as well. And the plaques has to do with the waves that are coming based on the probe being on your finger. So you see no plaque. You see the next slide where you see a little plaque. And type 2 is not so bad. When you get down all the way down where you see the last one there on the form, that isn't good. And I have tested a lot of people and have seen that and then set them up for vascular studies, echocardiograms, and to see what else is going on. And then from there, they have to be usually sometimes referred to their own primary care, or, like I said again, I work with several wonderful cardiologists so that we can get this turned around. And retest. A lot of things you just don't know could be so easily turned around with your diet, nutrition, to get things back in balance for yourself. So as we go through, we look at, the problem with arteriosclerosis. Arteriosclerosis is all that plaque building up inside the arteries. And again, we don't want to see that. But again, you can turn that around. You can turn it around. And the next slide, you're going to find that and this here is just showing you a little bit of sometime what the plaque look like. It is very yellow. I have drawn blood on patients and put it in a centrifuge and spin it around because it has to be done before it goes to the lab. And sometime I have seen fat. I wanted to bring one. You can see the fat inside of the tube. And I can just shake it back and forth, and you can just hear it moving around in there, all the fat that's in the diet. So I want to share something here while we're at this point. I had a lady that came to me, and she her doctor told her that she needed to go on a statin medication because of her cholesterol level was very high. Now, I hadn't seen her in a year. She's a small frame woman. She exercises. She had a good diet. But her cholesterol, triglyceride, LDL, everything was extremely high. But I just did not believe that was her lab test, even though I had not seen her in a year. So I said, let's repeat it. We repeated it. It was still very high. So at that point, she said, I just want to do something nutritionally to bring it down. So within 3 weeks or so, we retested her, and guess what? Her levels were normal. But she forgot to tell me something. After we discussed her nutritional value, she forgot to tell me that she had gone to one of the large chain outlets, and they had shrimp on sale. And she was eating shrimp every day for 7 or 8 days. And that's what drove those levels up very high. So before someone tell you your levels are high, get a good diet history on what you had been eating to see what you had prior to the blood test. If it was so high because of your diet itself, could have led to the fact that it was high. And I think you should have more than one test to see what's going on before you're placed on medication, because I am not a big advocate on any statin drugs, because that's one reason why my dear beloved uncle is not with us, is because of the statin drugs. And I'm not going to go all into that again because I have discussed it before. But we know there's a multitude of problems that relates to the statin drugs. And at one time they had taken some off the market, and then they went back on again. So the next part of your test here is vascular aging process, the key to identifying what's going on in the body. And these terms are so valuable. I cannot begin to tell you how valuable this section of your test is. And as you see that chart up there, it goes from like the normal range, below normal. But what's important is your optimum level. Normal means that they just went and took everybody's test and everybody showed normal, those who were close enough to normal. But you do not want normal, you want optimal. You want to be in optimal health, and that's what's important. You want your heart and your circulation and your cardiovascular system to be an optimum level, not just normal. So optimum level, when you get your report, when you see it, is 70 and above. So we're going to go through each one of these: the DPI, the EC, the AC, the RBV, which is so important for you to know. It's such a valuable tool. I cannot express even more. A lot of people have had this test, and they wanted to know, what does all this mean? And it's such a quick test that you wouldn't believe you get such valuable information. So as you look at each one, the DBT, the DPI, really has to stand for the differential wave pattern index. And this represents the overall health of the vascular system. As you see the chart there, you see the overall vascular system. And that's throughout the whole body, from your brain to your extremities, to your abdomen, to your upper thigh, your legs, everything. So you see the DPI, which is on the page here. So it represents the overall health of the cardiovascular system. The DPI is the indicator that represents the aging of your vascular health. So you want that 70 and over. You don't want that under 70. So I test a lot of people, and when I saw that, I said, let's do some things further, because that's important. So the next one is the EC. Now the EC of the heart, and you see the heart valve there itself, is dealing with that left ventricle of the heart. And the EC has to do with the contraction power of the blood vessel of that left ventricle. I cannot begin to stress. This test alone, if you were to have it done somewhere else, will cost a fortune. Now, next month in December, I will be doing this test at the Marriott Hotel in December. And instead of a person paying $250 at this event, it will only be $20. And I will be providing a workshop there as well, which is going to go more in depth than what we're doing right now on the show. But I want everyone to come out and have that. But that left ventricle of the heart, you hear a lot of times people say their left ventricle is enlarged, especially with people who have high blood pressure. That left ventricle is like a person running track. And as you run track, what do? You build up muscle. The heart is a muscle. And we call it LV, left ventricular hypertrophy, LVD, or some people call it. But anyway, that left ventricle is like this. It's pumping. And when you have all the stress going on in the arteries, it pumps so hard that it causes the left ventricle to enlarge. Now, this test, when we're looking at this, is looking at how the left ventricle is contracting. You want that to be 70 and over, because if that left ventricle is not contracting the way it should, you're going to end up with lung problems, because leaving the left ventricle goes into the arteries, and it goes into the arteries of the pulmonary valve, and that's going into the lung. And people end up with heart failure and everything else happening, and congestive heart failure, because what's going to fail first is usually the left, then the right, and then there's congestive heart failure. And you don't want that. A simple test, 3 minutes, no needles, no pain. So the EC is really important as to how that left ventricle is contracting. The next one is EA, the arterial elasticity. Our veins can get very stiff. And when that happens, it sets you up some major health problems, which I'm not going to go into a whole lot of details with those neither. But those problems are when people have symptoms of the poor peripheral circulation. And they would say, my hands and feet are cold. Now, there's other things that can cause hands and feet to be cold. The thyroid condition, hypothyroidism can do that. There's other things. But if your tests show that you're under 70, which you're not in optimum health when it comes to the arterial elasticity, if that's a problem there, then we have to turn that around because your peripheral vascular circulation is so important for our atherosclerosis. Don't you think that's important? So your lower extremities, usually people, and keep in mind, it's not just the lower extremities, it's also the brain. So we look peripherally. Peripheral means anything away from the center of the body, anything away from the heart. So it's your arms, your legs, your brain. So we look at all of that, which is so important. And this is a 10-minute, just a 3-minute test to find all this wonderful information. And I keep stressing that because everyone should have this test. They really should. So as we go to the next one, and again, we look at the RBV. Now, that one is critical. That's one that I had to work a little bit on myself when I did the test. The RBV, that's the remaining blood volume in that left ventricle. Again, where you see the red, and at the lower part, again, that's the left ventricle. If there's too much blood that's left there after the heart contracts, then that's the problem. You're going to get a backflow. You should not. We have valves in the heart, to keep blood going one way. But if things start to build up, this is where you end up with congestive heart failure. You end up with pulmonary edema, and that's fluid in the lungs. You don't want that. Again, this is a 3-minute test that can save your life. So again, that RBV, remaining blood volume, we want to know what is happening there, and we want to improve that because that can cause you some major health problems. Some of the symptoms, or if you're not an asthmatic and have respiratory disorders, some of the symptoms could be wheezing, fatigue, shortness of breath, on exertion. You can't walk upstairs well. There's some telltale symptoms there sometime too. Again, a lot of these are silent killers and you have no symptoms. So it's really important that you know what's going on with that left ventricle of the heart, if there's any blood volume where it's remaining there, and if it's a backflow going into that pulmonary system causing you to have pulmonary edema. And I'm sure you probably heard some people say, I have pulmonary heart disease or pulmonary hypertension and all these other things dealing with the lungs. So again, that left ventricle of the heart, we want to know what's going on there. And then there's other tests. Like I said, this is not a standalone. I don't use it as a standalone test, meaning that I will do other tests. There's blood tests that should be done, and there's other specialists, physicians that I would refer you to. Since I am not a physician, I am a board-certified practitioner, but not a physician. So again, I am qualified to do what I do, and the one important component is you know your body. You know. And don't just let anybody tell you when you go to get your results, oh, everything looks normal. Everything looks normal. Well, their interpretation of normal is not optimum health care. It's not optimum health. So you want to know, what are those numbers? What are those numbers? What are you telling me? Ask questions, please. It is your body. It is your life. It is your health. So the next phase that you see there, again, I went over the heart rate, which is very important, and we should be in a certain range. Again, it's going to show you if there's any artifacts, and artifacts are cardiac arrhythmias. And again, you want to know that because the normal should be under 6. Under 6 abnormal beats in 3 minutes, which will be a cardiac arrhythmias. And I have seen so many here lately that have been much higher. Now, it could be related to stress, but we have to then rule out and find out what is causing this to happen. What exactly is causing this to happen? And the one component I really love, I love the whole test, don't get me wrong, is your stress score. Can you imagine in 3 minutes it can give you your stress score, whether it's mental, physical, or stress resistance? Those components are very important, your stress score, because stress can affect every organ system of the body. And as we know, stress can kill us. So we could start at the top of the head and say, it can lead to brain fog, being forgetful. It can affect your vision. I have someone right now that has been under so much stress that it has totally affected their vision poorly. So we look at other things too. We want to rule out, glaucoma and cataract and other things too. But stress can affect everything in your body. So it's going to let me know what is your stress score. So you want to be in a normal range. If it's low, we need to identify what's causing that to happen, and then put you on a program that's going to help you to reduce the stress. Where's your happy place where you can feel relaxed and take a deep breath? Trust me, I had to do that today coming here. I had to find my happy place because even though I do speaking engagements and everything, it still made me a little nervous to come into the studio without a guest. So my stress level today was a little high. So I started doing my deep breath, and thanks to Tony here, Tony Sweets, who, his wonderful comforting hug was very powerful and to help relax me as well. So thank you so much, Tony. So I just want to say that keep in mind the autonomic nervous system has a lot to do with the stress, and that's what we're headed into now. But know that stress score, because that stress, when it's out of control, will cause you some definite problems. But let's know what the results are. So as we keep going and we look more at what the ideal stress level should be, there is a graph there. So it's no numbers, but it's showing you want to stay right there in the middle or right in the area where it says stress. And the good thing about this test, it's all saved. So it's repeatable. So when you do the test again, you can see, where am I now? Is what I'm doing, is it working? And these things you want to know as soon as possible. So when we get into the autonomic nervous system, you're going to see a graph when we do your test. And on the red is the sympathetic, and the right is the parasympathetic. Now we say fight or flight for sympathetic, which is very important. If we look at parasympathetic, we want to look at rest and digest. Rest and digest. When you rest, you can digest your food better. But if you're in fight or flight, there's going to be some major problems there. So in this test here, we're able to find out in 3 minutes what is going on with the autonomic nervous system, because if we don't get that in balance, we can definitely go into some serious problems. And I'm going to go more in detail in that. You see a chart here, and it has to do with other frequencies and part of the testing, and it'll allow me to find out if your frequency is so low. Those bars are very important. It shows you a healthy person and an abnormal. Because a lot of patients have copies of your results. This is one reason why I'm doing this show, so you can better understand what's happening when you look at your own results. So we want to know exactly what's going on. If it's thyroid, then we need to address thyroid. If you're not able to cope with, the stress and things going on in the environment, that's also a different story. So if we go into the autonomic nervous system, we're going to discuss a little bit in detail, because when the autonomic nervous system is not in balance and there's a deficiency in the sympathetic and parasympathetic, they're not balanced. They should be balanced. And quite naturally, we will have a little bit more higher on the sympathetic if we're working out, if we're taking an examination. But you just don't want to stay there, because when you stay there, this is when you start to have problems. So you'll have problems with digesting your food and a multitude of problems. So the sympathetic nervous system, we want to know. And when I see that stay high with a person, the main component of lab work that I want to test right away is cortisol level. Let's see what your 24-hour cortisol levels look like. And you can go to lifeextension.com and order those tests yourself. You don't need a doctor's prescription to order those tests yourself. But I wouldn't just look at that, because We heard of telomeres before, those wonderful normal telomeres. Telomeres are very important. Well, when you're under all this stress, you're shortening that as well. You're also causing more anti aging or aging to happen to your body. So many things happen. Again, keep in mind the parasympathetic is more of the rest and digest. But we don't want that to stay very low. If that's always very low, then there's going to be some problems there. The most important is to balance, to make sure that everything is in balance. So the effects of the autonomic nervous system and its dysfunction. The dysfunction is your whole entire life, your production of energy. When the autonomic nervous system is dysfunctional, you're going to have problems with energy, sleep, brain, muscle, your connective tissue in your body. You're also going to have more inflammation and cytokines to increase in the body for inflammation. So your inflammation markers are going to be high. You're setting yourself up for more cancer problems, heart attack, diabetes. All of that is when the autonomic nervous system is out of balance and you're holding on to all this stress. Again, the immune system. Some people say, I have a cold every 2 days. I'm always sneezing. I always have this going on. Yes, it could be allergy. But if you're under a lot of stress, it's going to hit your immune system. It's going to hit your immune system. So you want to make sure that you get enough sleep. Because when the autonomic nervous system is not balanced, it's going to affect your thyroid. It's going to affect the liver. And guess what? It's going to affect your intestines. Okay? So it's very important. So we're going to kind of break down each one because I think each one of those pictures are very important. So production of energy. So when we have production of energy, we look at the fact that when that's happening, you crave sugar. You're going to crave comfort food when that's happening because your energy level is so out of place. Those cells for energy will cause also insulin resistance, and there's a problem with insulin resistance. Now, those of you, especially women, because I'm a woman, we look at our waistline. And if your waistline, even with men though, start to get larger and larger, 9 out of 10 that cholesterol, that your cortisol level is increased. And you start to hold these pockets of fat all around the waist. So again, let's always check the cortisol level, which is important. So when the autonomic nervous system is not balanced, I cannot stress that enough, you're going to have decreased energy production. And then how do we turn that around? So we're going to discuss that as well. But keep in mind, all of these problems, you have excess fat, diabetes, heart disease, all of these happen because of dysfunction in the autonomic nervous system. That's your fight or flight. And your sympathetic is too dominant, too high. Again, with your sleep. Sleep is so important for so many reasons, as we know. We know that statistics show that if you're sleeping less than 8 hours or less than 5 hours a night, that you will end up having cardiovascular problems. We need the sleep for so many reasons. Your cortisol level usually will be higher when you're not getting enough sleep. And what is all those functions with a high cortisol level? A multitude. So we want to make sure that we're getting enough sleep. And you're going to have more depression and fatigue. So all of this, you can monitor your depression, fatigue, insomnia, all through doing this test. Because when things are out of balance, this is where you're going to be. And you wonder why I'm not sleeping, why this is happening, why that's happening, why my hair is falling out. All of this, you want to look at the whole clinical picture, which is important. So sleep is really important to make sure that we're getting enough sleep and keeping things balanced. The brain itself. You have damage to the neurons. When the sympathetic system stays high, there's definitely damage to the neuron and the receptors of the brain. And when this happens, this is when you have more learning disabilities, you have more depression, memory loss, and these are people who are chronically fatigued. They're just chronically fatigued and chronically stressed. We have to find a happy place so we're not chronically fatigued and stressed. So you can see the changes in the brain itself just from this. Again, you're going to find out all this information with a 3-minute test. 3 minutes. Isn't that amazing? So I'm so excited that I have this machine. And again, here's your bone and your connective tissue, your tendons. All of this is affected by an abnormal imbalance in the autonomic nervous system. Again, I am so thankful that you are all listening to this show. Thank you. And please, please take time to share this. I would share it right now so your friends and families can actually listen to the show. Please share the show. You don't seem to heal well the repair of your bones and tendon when you're under a lot of stress, because the body needs the chemical makeup so that you can heal and repair well. So if you're under a lot of stress, you're not going to heal as well. You want to make sure you get into a quiet place, relax, so that you can heal a lot faster. So we see a healthy bones here. We know that cortisol levels, when they're high, can lead to osteoporosis. So again, you want to make sure that you know what your levels are, because it's so important. And then we look at bone health, and we see the matrix of that bone and what's happening to that person as time goes on. And this is when the cortisol level is too high. Again, people are starting to walk differently and things happen. Maybe it's some vitamin deficiencies. Again, everything is checked out. It's not a standalone. But we do know nighttime cortisol levels increase. Your cortisol levels will elevate, which will cause problems with the bone developing. And you want this to happen and do well while you're sleeping at night. It is so important to get the proper sleep so you don't have these problems. And as we move on to the immune system, and people sometimes look at the immune system and they forget it's a complete system. When you have decreased production in your white blood cells, and a lot of times people come to me and they have a low white blood cell, that's telling me too that you have a low immune system. So you want to know and get a good interpretation of your lab results. At New Wellness Healthcare, I actually go through functional blood studies with each one of my patients so that you know exactly what's happening with your blood work and what that means on an optimum level, on a functional level. The functionality of you and your body and how things are progressing is so important. So when we look at the immune system, there's several components. There's your thymus gland, there's your spleen, there's your liver, your lymph nodes, your lymphatic vessels, your bone marrow, your appendix. You look at the whole system, your other glands. You want to know exactly what's going on as it relates to the immune system. So when a person say, oh my goodness, my immune system is weak. Okay, so where's that stemming from? And what area of the body is that stemming from? Do you have a low white blood cell count? Do you have increased inflammation markers? Or your cytokines increase, which can cause you a lot of havoc? Or your other hormone levels, your insulin resistance, is that high? We look at insulin too as a inflammation marker, which is so important. So not just the insulin coming from the body. And while I'm there, I just want to say something, because I was a little taken back of what I've seen in the news here recently. And I won't say news, it was something that showed up on television. And the statement was, in 2020, there would not be enough insulin for diabetics. To me, that's very frightening. Instead of saying, why can't we start doing more to help diabetics so they don't end up on insulin? Why don't we help our people and help people in the world today so they don't become a diabetic? Instead of coming out saying, in 2020, guess what? We're not going to have enough insulin to serve diabetics. Now, you might have seen that article, or you might have seen or heard this yourself, but I'm telling you, start now Start now, especially if you have a loved one who's on insulin. Start now and taking some steps to help your body to start healing better and not get worse. Sometimes people start to take medication, they get comfortable. They take a blood pressure pill, they take insulin, and say, well, everything's normal. But everything's been suppressed with the medication. Start taking more control yourself so that you can heal. I've come a long way with my own journey, and I'm telling you, I wouldn't be here today if I didn't take better responsibility of my own health. So I don't just put this information out. I practice what I preach. I like the word preach. So it's important to make sure we don't lower our resistance. Because when we lower our immune system, you're going to have more allergies. You're going to have more infections in the body. All these things, skin rashes, all these things are going to happen. So let's just make sure the immune system, we keep it strong. Again, when there's problems with the autonomic nervous system, we're still there, and there's a deficiency or an imbalance, you will have skin problems. So dry skin, it could be you're deficient in essential fatty acid. So I don't say go out and just start taking certain supplements. You want to be worked up properly, and that's is really important to have a comprehensive, tailored program for your needs. And we used to say the root cause. And my daughter and I, Siobhan Kamen, we have decided that the root cause sounds so good. And everybody have used root cause. But what's under the roots? What's under the roots? So we got to go beyond the root cause so we can get you to a more homeostasis balance of your life. And that's what we do at New Wellness Healthcare. So again, healthy skin is really important. Now, again, it could be so many things. A high cortisol level can inhibit thyroid hormone levels and result in fatigue, body temperature change, and weight gain. That cortisol. So there's the thyroid there. You see that wonderful picture there. So again, it has to do with, secreting thyroid hormone and what's happening in the body to keep everything balanced and healthy. So it's so important that you know what is that cortisol level, how much stress you're under, your autonomic nervous system, if it's deficient, if there's a problem in the balance, you're going to have overall health problems that you don't have to have. And also, men, the libido. There's going to be a libido problem. You're going to have a lot of problems with cardiovascular health, with erections. Now, I'm not going to look at anybody, but I just want to say that it's so important that the stress, you keep it under control. Because a lot of times, you don't need the blue pill. You don't need all these other things. You need to get more in a relaxed state with your mate so that you don't have all these other problems. And there's so many other things that can cause ED and you name it. But first of all, let's deal with the obvious first. Let's deal with the stress. Let's see what's going on with the cortisol level. Let's just make sure you do this 3-minute test to see where you are. So now as we look at the pituitary gland, and the pituitary gland, low pituitary hormone levels inhibits the thyroid, as we know, in male and female, which is a growth hormone. And there's major endocrine problems. Now, the endocrine system is all your hormones in your body. Sometimes people just want to look at it's just the hormone of the estrogen and progesterone, but it's every hormone in your body. So we want to make sure with the pituitary gland that is functioning well. Again, if your cortisol level is high, you're going to have problems there as well. So every hormonal balance in the body is going to be in balance because of the cortisol level. And again, that autonomic nervous system, and again, stress, they go hand in hand. So we have to get everything in balance. And I keep repeating myself because I see so much of this every day, every single day. And as we go to the next phase, we look at liver. So abnormal cortisol level stresses the liver for detoxification pathways. And you see this liver here. I have so many people telling me, I'm on a liver detox. I'm on a liver detox. And dealing with liver detox, there's a phase 1 and phase 2 for detoxing the liver. It isn't just I'm going to jump in and start detoxing my liver and take certain supplements and do this and do that. You can set yourself up for some trouble. You want to be with a practitioner that know what they're doing and make sure that phase 1 and phase 2 are handled properly. It's something that I have been doing for years, and I do it very simply, and it covers both phase 1 and phase 2, and it works well. Even with hepatitis, any liver disease, I've seen lab work turn around in 14 days. So I'm looking closely at your blood work because that's giving me a snapshot of what's going inside your body. So I want to say that this test dealing with the liver, again, abnormal cortisol levels will affect the liver. And if we get into the intestinal disease, I have so many people with intestinal disease. And then when you look at stress, it's going to affect everything from going in the food when you put it in your mouth to digest it when it leaves your body. There's going to be some problems there. So abnormal cortisol levels weaken the intestinal walls. It weakens the intestinal walls. So IBS, irritable bowel syndrome, a lot of people with GERD, ulcers, colitis ulcers, Crohn's disease, and again, anything dealing with the colon, you're going to have a problem. So IBS, small bacterial overgrowth. So you want to make sure that that cortisol level, again, stress, you stay in that mode of stress. And we can have it on the freeways, daily driving. Put on some soft music. We find some ways to start relaxing. You know, do your deep breathing exercises. Sometimes we don't have time to go run to the gym. So, you know, while you're in traffic, just do the deep breathe exercise. And while you're driving, just think of gratitude. I'm grateful this morning. I'm grateful that I woke up. I'm grateful for this moment. I'm grateful I can hear. I'm grateful that I can see. And some people can't because of other reasons. But I'm grateful that I'm alive. Because you would not be listening to me if you were not here. So I want to say it's so important that you take the time and know that you can make these changes happen in your body. Again, this is a 3-minute test. 3-minute test. All this information I just went over today, you can find this out in 3 minutes. And there's so much more. So I pray that everyone attend the workshop. I'll be having more information for you for December at the Marriott, and give you the date and everything else, where this $250 test will only be $20. And you will have the results the same day and repeatable. So if we need to repeat this in a couple of weeks, you want to go and do some of the changes. You're going to start sleeping better. You're going to eat better to see what's going on. We can repeat this test. Now, you want to tune in next week, because next week I'm bringing the machine to the studio. I'm bringing it to the studio, and I will be demonstrating this test, this 3-minute test, in the studio. And I would have several guests here that are putting on this wonderful event that's going to take place in December. So I just want to thank you for taking the time to listen to New Wellness TV/radio with myself. And I am eternally grateful and honored to have the privilege to be in front of you today to offer this information. May everyone have a wonderful, blessed day. And as I always say, repeat after me, because the power of gratitude can bring you so much more. Be grateful for what you have. So repeat after me. I am so grateful that I am a magnet for miracles. This is you, not me. We're all magnets for miracles. Let's bring that in. Bring in the magnet. Bring in the prosperity. Be grateful every day to God that you are still here. You know, sometimes we don't look at the small things, like we're breathing right now, like we're alive right now. We forget about those things. So the autonomic nervous system is automatically, we just know our heart is going to beat when we wake up. We know that air is going to be pulled into our lungs. An autonomic nervous system don't have to work for you all the time. So when it stopped working, we're out of here. So I want to say thank you very much for taking the time and the opportunity to listen to the show today. And please pass on this information. Have a wonderful, blessed day.
Join us every Wednesday live at 11 a.m. for a new Wellness TV with Dr. Lee. Remember, healthy mind, healthy body.